The vaccine rollout across Europe has hit headwinds as more countries across the continent are suspending the AstraZeneca vaccine. EU governments have said they would lift suspensions on the drug as soon as the European Medicines Agency advises it's safe. This after reports of abnormal blood clotting. Across the rest of the world, vaccine doses are continuing to be administered, with Israel having the highest percentage of residents inoculated so far. As part of the Bloomberg Equality Summit, I spoke with Melinda Gates on the global COVID response and asked how her foundation is making a difference, where the vaccine rollout is working and not working.
Well, I think it's working in some of our high-income countries. We're starting to finally see, much broader distribution, for instance, in the United States and in some of the European countries, but it is not at all working yet for middle and low-income countries. And, those are places where people are struggling. They have their loved ones who get ill. They can't get them to a hospital, much less an ICU. And so they are really still struggling in many countries around the world.
So there's obviously a moral case for vaccine equity, but what about the economic case? Why should somebody in New York or San Francisco care when somebody in Africa gets the vaccine?
Well, absolutely, it's the right moral thing to do. But economically, we're not going to have as swift a recovery in the United States or in Europe if we don't make sure that everybody gets vaccinated, because what will happen is this disease, we know it crosses borders. We've seen it all over the world. And so as these variants break out, they will absolutely come back into the United States and Europe and Japan. And so our supply chains won't fully be up and running. We won't get our travel industry fully and leisure up and running, or the business community up and running in terms of travel. So economically, if we're going to reopen the global economy, we've got to take care of this everywhere.
So if vaccines aren't distributed equally, obviously there's economic consequences. There will also be more deaths. What are the consequences of that?
Well, more deaths, it's a tragedy for every family that experiences a loss. But it's also, I think we have to remember, it's wreaking havoc on the healthcare systems of these countries. And so what it means is a mom who is pregnant doesn't go in for her antenatal visits. She doesn't go in for delivery. So she has an unsafe delivery at home. It means we have 49 million women that won't get contraceptives during this pandemic. That means 15 million unplanned pregnancies in 1 year. That's like adding up the cities of Chicago, New York, and LA and saying we're going to have 15 million unplanned pregnancies. Wow.
Vaccine nationalism is stepping up as this continues. You've got nations competing for supplies. Do you see a better way?
Well, I think, we started off as a world with a good way, which is to try and pool both the demand and match it to what would be the supply, and to have financing for that. The U.S. didn't come into that financing until the last stimulus bill that happened in December. They finally put money forward for Gavi, which helps with this facility called COVAX to purchase vaccines and get it organized. We just now are coming in with this latest stimulus bill for testing and treatment. But, that would have been the way to go, is to really match global demand and supply and first get it out to all the healthcare workers all over the world before you even begin then going to vulnerable populations.
Meantime, there's continued disinformation about vaccines. How do you and Bill see that kind of misinformation?
Yeah, when you see it, I will say it's incredibly disheartening, because honestly, it causes death. People not doing the right thing, not getting their mom or their elderly father vaccinated, we'll lose more people. We are losing more people. So it's disheartening. On the other hand, as more people are getting vaccinated, just take the United States, we're seeing more demand for vaccines. So we're finally seeing the counter-cyclical part of that argument. But it's always disheartening to see something like that.
Now, a huge part of your job before the pandemic was traveling around the world, meeting people, talking to them in person in far-flung places that most of us don't get to go. How has your job changed during COVID now that you can't make those trips?
Well, I think like so many others who are lucky enough to be able to have access to a computer and a good internet, right? I'm doing a lot of meetings online, and they are pretty continuous throughout the day. I am certainly meeting with still leaders around the world, even community organizers around the world. But I miss the, deep connection and interaction with women in her home, or a man who's working in his field, or the children. I miss that. And so I look forward to when that will return, hopefully in the next year.
In your annual letter, you and Bill said the recovery starts with women. What do you mean by that?
Well, women have had the most devastation, women and people of color, during this crisis. We know women have left the labor force in droves. We know they're at home with this complete caregiving crisis, taking care of the young, taking care of the elderly. And so if we're going to have a full response and a swift response, we have to stop thinking as a world of gender equality as this nice thing to do when we get to it, or this side issue. No, it is the central issue. If we're going to get a full recovery and a swift recovery, we've got to address all of the issues that are facing women. We are in a crisis for women and people of color in this country.
Now, the last time you and I spoke, it was about your book, The Moment of Lift, How Empowering Women Changes the World. That came out 2 years ago on the heels of Me Too. There was a lot of hope. Have you seen that play out, or have you seen progress derailed?
We've seen, I would definitely say that was a moment of optimism for me. And I would say now I think women are in a moment of crisis. So we've seen a lot of work derailed. We've seen women women in the last 30 years were coming out of poverty as a globe. And now we're seeing a huge setback in that arena. We're seeing setback in the labor force. The number of women who've stepped back from the labor force in the United States, 2/3 of the jobs lost in South Africa were women's jobs. So I think we're in a moment of crisis. But then on the flip side, I see these female leaders, Prime Minister Jacinda Ardern, Prime Minister Merkel, how well their countries are doing. Or I see these self-help groups in India that immediately mobilized and got messages about COVID out to millions of people in northern India. So I see the hope on the other side, but there's a lot of work to do.
Melinda Gates, co-founder of the Bill and Melinda Gates Foundation. We're going to have much more of that conversation at the Bloomberg Equality Summit.